following presentation is a project of the Native American Women's Health Education Resource Center. According to statistics gathered by the NAWHERC, Native American women face discrepancies in all areas. 57% of American Indian women reported having had sexual intercourse by the 12th grade. The average age of first intercourse was reported to be 14. 42% of all American Indian mothers reported being under the age of 20 when they had their first child. 27% of American Indian youth reported having received no routine health care in the last 2 years. 41% of American Indian youth reported having no health insurance at all. Children from violent homes have a higher risk of alcohol or drug abuse and juvenile delinquency. 92% of American Indian girls who have had sexual intercourse reported having been forced against their will to have sex. Suicide is the second leading cause of death for American Indian adolescents. Among adolescents ages 10 to 14 years, the suicide rate is approximately 4 times higher than for all U.S. races. Alcohol and other drugs affect the lives of American Indian girls and young women in a variety of ways. There are higher rates of family violence and child abuse, elderly abuse by youth, teen dating violence and sexual assault, and teen girls fighting each other. There is a 50% greater chance of teens drinking if parents are alcoholics. There is a staggering amount of violence directed against Native American women. The incidence of rape in the American Indian community is 3.5 times higher than among other communities. That means over 1 in every 3 Native American women will be raped in her lifetime. In a recent survey, 44% of Indian Health Service emergency rooms reported not having an accessible protocol or trained personnel in place for sexual assault. For facilities that do not provide services to sexual assault victims, women are required to travel an average distance of 28 miles and some as far as 150 miles to obtain services. There are many things communities can do to help combat the violence. By identifying issues, prioritizing issues, developing solutions, and initiating those solutions, the community will stand a chance in the fight against violence. A strong foundation can be built as well as a sense of self-identity through the acquisition of the Dakota language and value system. Assisting young American Indian girls to develop the skills necessary to protect themselves from sexual assault and violence through community education is also desperately needed. Developing leadership will build a strong future and address external pressures including racism, classism, sexism, and internalized oppression. When the community comes together, headway is made on important issues. Acknowledging traditional birthing customs and ceremonies is a vital step in the healing process. This can be done several ways: by embracing our traditions through the reintroduction of the traditional midwife and birthing experience, by encouraging our young mothers to breastfeed their children, by educating our youth before they become parents of the benefits of being chemical and alcohol-free, and by educating the community on the effects of environmental contamination on our health and the health of the next generation. It is important to embrace the diversity of our elders. This includes our spiritual advisors and medicine people, our two-spirited sisters and brothers, our traditional historians and keepers of our herbs and medicines, our powwow dancers and singers, our traditional leaders, our tribal leaders, our veterans, and our college graduates. We need to respect the wisdom and teachings of our elders. This includes respecting all Native ways of life, listening to the wisdom of our elders, learning the teachings from our elders, respecting their limitations, including them in all activities, and creating a comfortable environment for the transition of life. For more information, contact the Native American Women's Health Education Resource Center, Pidamaya.